How to teach independent self-care routines in children with development delay.
Many children faces challenges while doing the self-care activities, and as occupational therapists, they will help you guide how to promote independency in a children who have delay in their self-care activities, who have difficulties. It can be either physical or a mental or cognitive barriers. So here are the list of the activities that you can do at home if your child is facing the same kind of difficulties. The first thing is always make sure that you do not demonstrate the activities overall, but instead break the instructions step by step. You can break the instruction and also use visual cues like visual charts or flashcards or a video modeling. Make sure the child understands what he is doing before, and you can also demonstrate to the child yourself in a more of a step-by-step process. And the second thing is weight shifting activities that will help in trunk rotation. For example, many kids have problem in turning and washing their backs because they might have midline difficulties. So during that, you can give them weight shifting towards the side. You can make the child sit upright in a chair or make the child kneel down and pass the ball at the sides. So passing balls at the sides. And the next thing you can do is you can place a sticker on their back and ask the child to remove the sticker, which will also improve their body awareness. You can also place a sticker on their hands and tell remove the sticker from your hands, so the child knows the difference between the hands and the leg, which will also promote their body awareness. And the next thing is squatting. Many kids have problem with their hamstring muscles. You can promote squatting. During squatting, you can give them, like, ask a child to sit in a squatting position and give them any sort of activities to do in the squatting position. The next is balance activities. Many kids need to balance when they do any kind of self-care activities. For example, removing their pants, removing their underwear. They cannot be able to, they need to stand one leg. So make sure you give them one leg standing activities. While doing one leg standing, you can make them do any sort of activities, or you can make them wear their socks or a rubber band standing in one leg, and this will promote even the balance for the child, balance and coordination. And the next thing is motor planning. Make sure your child is able to do 3 activities together at a time. So they're able to plan their motor planning activities as needed.
Why child is putting things in mouth. Oral seeking behavior.
For those children who keep chewing on non-edible objects or licking, biting or grinding the teeth, this video is for the parents who have such concerns. A child till they're 2 years, they explore the environment with their mouth, which is very common for the child to keep anything in their mouth. But once the child is above 2 years, it is less common for the child to keep putting things, biting and chewing and other things. So your child might have such behavior because they might fall under such reasons, few of the following reasons, which I'll be explaining now. The first one is when they have developmental delay. If their child has developmental delay, even when the child is above 2 years, but they still have delays of their 1-year-old baby, then they will try to explore the environment using their mouth. Second thing is when they want to calm themselves down, when they want to self-regulate, self-soothe themselves, you might see the child licking or chewing on some with their hands or pencil or anything for the matter. And the third thing, which is the most important thing, is when they are sensory seeking. When they have sensory seeking in their oral muscles, or even when they have sensory seeking in the proprioception. When I talk about proprioception, you might wonder, why am I telling proprioception in the mouth? Which jaw is one of the strongest muscles in the body. So when they have seeking in their proprioception, they might want to tend to bite on other things. They try to grind their teeth and other things. For children with these kind of challenges and concerns, as a parent, you can follow the list of the activities that I'm going to be telling now. First is oral massage. You can start with the massage, but here I want to put a disclaimer. If you are not confident or if you have not had the experience before, you can always approach an occupational therapist or a speech therapist to use this massage. So massages, I'll explain now. The first thing is you need to keep your hands on your jaw at the back side. From up to down, just give them a deep pressure. From up to down, and up to down 10 times, 10 to 20 times. And then you can keep them tapping on their jaw joints here in the chin. Below the chin, just give them tapping here and a normal rotation on the cheeks, like 10 times clockwise and 10 times anti-clockwise. So this is the massage. And secondly, you might notice there is an electronic brush, the oral B brush, where you can give it on the child, place it on your jaw joint, and you can give them strokes here, like up to down 10 times here, 10 times over here, and you can also place it inside. For kids who are seeking senses and they want a proprioception seeking in their joint, they would enjoy when you give them this massage and the vibration senses that they would want. So when you do give them, there might be a reducing of such concerns. And a third, like an activity, you can always give them heavy, crunchy foods. Maybe you can include this Indian snacks, murukku, namkeen, and everything in their day-to-day routines. And for kids who want to chew on everything, you can give them frozen items like frozen fruits, ice cube, and you can just keep it on their mouth and they can do this. And there is always a chewy tube which is available online and which is non-hazardous. You can take the chewy tube and ask them to bite 10 times on either side of their jaws, like 10 times this side and 10 times this side. And if you feel your child is doing that regularly, even when they go outside to a mall, to a theater, to any kind of function, you can always have this chewy tube handy. And when they try to do that over somewhere else there, you can give them, you can replace it with the chewy tube, which will be compensated when they go outside. You can also include a lot of weight bearing and proprioception activities like crab walk and bear walk, jumping. When the child, like I told you before, when the child seeks a lot of proprioception activities, like proprioception senses, that they might also tend to bite on other things. So make sure that a child gets enough physical activities, including oral activities.
What are the OT aspects that parents have to concentrate on older children?
So many of the parents have asked me like how do we proceed in therapy once the child reaches a particular age? Whether should we keep giving them the sensory regulation and physical activities? What are the other skills we need to focus on? Here I would always like to implement that an occupational therapist focuses on the performance area of a child, which is the day-to-day skills, where ADL, leisure, which is play, and their self and their academics. To start with self-care activities, you can always go to an occupational therapist to ask them to assist them into making your child do their self-care activities independently. Especially your child might be 9 years and he still doesn't know how to cross a road or how to take bath, how to do anything independently. You can OTs will always help you, will train the child to make them to do their self-care activities in more of their own self independently. And second thing is their play, which is a very important occupation of a child. It's a very important occupation of a child where a child needs to know how to make bonds, how to have parallel play, how to make friendships, and the social skills. And Otis will help you and will guide you, give you tips how to help your child form a relationship outside there, in their community and in their schools. And the third thing you need to focus is the academic skills. Your child might excel in other ways, but then in academically you can focus on their pre-writing skills, board copying, to pay attention and focus in the classroom. A classroom is a very competitive area. It's a place where a child sees a lot of other people, and your child's self-esteem is very important. So make sure that your child, no matter the amount of praise, amount of appreciation that you're going to give, a child should have the sense of self-worth and self-esteem that's coming from within themselves. And the best way to give that is to make your child do everything independently. So it is more like a self-reward for himself. And there are other few skills that I would like to personally mention here. The first thing is the emotional development. A child might be 13 years old and have the emotional development of a 9-year-old kid. So you can ask the therapist, how do you teach them the emotions, how to teach them the problem solving techniques, and also cognitive skills. You can focus on their cognition skills. And when your child is going through puberty, you can, in a different specialized, in a more of a different way, you can teach your child about the changes that's going to happen during the puberty.
My child has trouble sitting still. What activities to do for sitting tolerance?
So many parents have complaints about the child having any sort of sitting tolerance to sit in a place and to complete an activity. And today I'm going to be talking about the reasons and also the activities that we can promote sitting tolerance in a child. With the number of ADHD increasing, it is less uncommon for a child to have difficulties in attention and focus. So a lot of kids have problem with their hyperactiveness, attention, and to sit in a place and to complete the activities. And secondly, when the child has vestibular seeking, they are always wiggling and jiggling everywhere. They are roughhousing, clumsy, and they're not able to sit in a place. And the third reason might also be because of their processed food and the diet intake, because and the lack of sleep, and with a lot of like processed foods like snacks and other things and sugar, a large amount of intakes of chocolates and ice cream can also cause a lot of attention difficulties. So firstly, I would like to talk about vestibular strategies for kids who have issues in their vestibular senses. So here what we can do is, we can always replace their seated arrangement or sitting arrangement. Instead of making them sit in their chair, you can make them sit in the gym ball or a wobble chair or a swing. In that way, they can sit for a longer time. Here, I would also like to talk about movement break. We cannot make the child to sit continuously for 10. If the child has a sitting capability of 10 minutes, you should always take the movement break for 5 minutes. So don't make the child sit in the same place in a stretch, but replace. You can always take a movement break and replace the sitting arrangements. You can give them a wobble chair or make them sit in a wedge where the child will play more attention. And when the child with the vestibular seeking, when they attend the school, they are not able to sit in a place. You can also make we can also make the chair more adaptive towards in the classroom, where you can put the TheraBand at the side of the chair and your child can keep their head where they can support their leg in the TheraBand, and while even when the child is able to get the vestibular input, at the same time is able to focus. So vestibular is a very good strategy for making a child sit in a place. And second thing is, many of the parents complain the child is always running up. But till the child is 2 or 3 years, the child always seeks movement. So it is less uncommon, like where we can see a child sitting in a place or anything like that. The more the body demands, the more the body gets physical activity, the more the body gets the movement, the more the child will able to sit. So make sure your child is engaging in a lot of physical activities and where they can channelize the energy, and then they will have the sitting tolerance. And other things that we can promote sitting tolerance is, make sure your room is clutter free. It should not have a lot of distractions when you're sitting in a place. And the second set I want to address here, your child might not have any problem with their vestibular sensory, but still have problems in their attention and focus and concentration. For such children, you can give them activities to improve their attention and focus. For example, a board game. Make sure you give them any sort of board games, age related, or if your child is able to comprehend more difficult board games, they can just sit here and always keep your time limit. If your child is able to sit and complete the board game for 5 minutes, and we can keep our goal 10 minutes the next day. So board games is a huge way to promote sitting tolerance. To make your child sit in a place, firstly, apart from the physical activities and the vestibular activities, we need to make the environment more child friendly, interest for the child to come and sit in a place. So if you're gonna make him do any writing work or make him learn something with your speech skills, make sure you start with something of his interest. Make sure you have a doll or a toy which will create interest in a child to sit in a place, and lately remove the toy and then you start giving whatever activity that you are going to give him. Lastly, you can always use the counting strategies. Make sure you count one that to get the attention. Make sure you count with the backwards 5, 4, 3, 2, 1, and then you start asking the child to do their activities.
Tips to manage child's emotions like happiness, sadness, anger.
Have you ever heard of the term emotional regulation? It is the ability for the child to manage their own negative emotions like sadness, anger, or any sort of the negative emotions. So if you see, when a child experiences any sort of anger or sadness, they're not able to regulate themselves. So what happens is they start kicking, they start crying uncontrollably, they start throwing, because they're not able to manage their own emotions. So at that time, what as a parents can we do? So for the child who can understand, who has this ability to understand, who are more verbal and who can comprehend your instructions, what you can do is you can start with the counting activities. Always count like 5, 4, 3, 2, 1 in front of them, and then you can ask them to breathe in, breathe out, breathing in and out. So breathing exercises will allow them to calm and also relax their muscles. And the child who cannot understand such breathing exercises, what you can do is, the first thing is to always change the ambience, change the environment. If they're into the other room, you can take them to somewhere totally different. More, if it is a sensory calm down place, that will be more beneficial for a child. So always when the child is showing such kind of behavior, take them outside that place. Don't allow them to be in the same place. And the second thing is to have a sensory calming down place at home. If this happens quite a lot of time at home, you can always have a room with the dim lights, which is dark and dim lights, where the child feels more at home, more safe and comfortable, with a lot of cushions or bean bags. So having this such safe space at home can also regulate your child. Will always kind of divert your children. And the third thing is, you can give them TheraBand stretching. You would have heard of the TheraBand. You can just ask them to pull the TheraBand and you can push it. Pull it and push it. And the main thing you can do is, you can carry a fidget toy at home, like something like a rubber or a smiley ball. So they can exhibit their anger or any sort of thing, just crushing that or crushing the toy or crushing the ball and other things. In addition to all this, you can give them calming music, which is available in Mozart and YouTube. You can give them calming music or coloring or any sort of water play. If your child likes water play, just know what your child needs and try to divert them into a different thing. So slowly, the child will be able to regulate their own emotion, and they'll be more expressive towards you, what they need and what they want.